Today I'm going to talk a little bit about your grip strength and some very simple stretches that you can do to increase it, and some principles you can apply. Most people trying to increase their grip strength are going to grip something. It sounds really simple, but squeezing a ball or squeezing one of those little grip strength handheld devices that you can use. There are a lot of different things like that you can do to increase your grip strength. But I think people are viewing their grip a little incorrectly. Of course, the size and the condition of your muscles makes a difference, but in the case of strength, it's not just about size and condition of your muscles. Strength also has a lot to do with how well you can leverage the force that your muscles are generating. And you lose leverage when you lose dexterity or flexibility in your hand and in your fingers. And so some very simple ways to improve that have been talked about on the internet and in clinics like mine, across the nation, I'm sure, where you simply take your hand and you might stretch your wrist extensors by bringing your palm down and doing a number of stretches that way. Some people do it here. You can also take it the other direction and bring your fingers back and stretch your wrist flexors in that regard. And those are both good. But what's often overlooked is some simple stretches you can do for your hands. And so I teach these to anybody who plays an instrument, the strings, piano, or anyone who's got a grip. If I've got a massage therapist, a dentist, a hygienist, a mechanic, anybody who's got a grip tools, which is quite a few of us out there. So very simply, the first one I'd like to teach are called finger tendon glides, and you're going to isolate your fingers. We typically grip en masse like this, and we don't necessarily do one at a time, and we begin to lose that ability just from the trauma to our hands. You get inflammation and scarring that begins to make the different structures, the tendons in our hands, stick to one another. And in their worst cases, you can get finger contractures or trigger fingers, as they might call it, where your finger gets stuck. But at any rate, if you try to block 3 fingers and then pull one like this, not only will you feel the pull of this finger want to pull the ones next to it, okay, but that stretch is going to go down through your hand and down into your forearm as those individual muscles begin to pull on that finger. So you might just do that gently about 10 times and then go on to another one. And you want to block the fingers on both sides of that one. And then you go on to another finger. And you just simply do that all the way through until you get to your pinky. And so that's a very simple one to do that gets those tendons gliding past one another. The second stretch that I like to do and that I do regularly is called a lumbrical stretch. Okay, and there are some muscles in your hands called lumbricals, and they do this sort of a motion. And so the opposite thing to do would be to take this first knuckle and bend it backward. Sometimes you get a little pop like that. And you'll do that on each of your knuckles, on this first row of knuckles, the MCP joints. And you do that on each one very gently. Notice I'm not going to the end of my finger and pulling hard like that. I'm just very gently loosening those knuckles. Then you're going to take the two, the IP and the DIP joints, and you're going to bend them down. And so they're going to come down this way together. And then after you've done that, on each one of those fingers, all the way like that, and you're closing those down, is you want to try to keep those two bent while taking that first one back. So you're going to combine the two. So I may not do it up here like this. I'm doing this so I can show you. But you may do it just right down in front of you. And very simply, or you're sitting at a stoplight, or you're in church, or you just feel, when you feel like you want to pop your knuckles, or your hands just feel like they're tight or they want to cramp, I go through those two stretches. So the finger glides and the lumbrical stretches. Those are amazing. My personal experience with that, after doing a lot of manual therapy and hands-on work on my patients for a few years, and my grip strength started to go down like it often does for many people, is the first month that I did that about every day for a month. At the end of the month, my grip strength increased 30 pounds, which is pretty significant. That wasn't doing any sort of strengthening. It was just simply restoring the leverage to my hand by getting more motion, more flexibility. So good luck with that one. You should get some great results, and I'll teach you more on another video.